Hey, so today I want to talk to you about anxiety, and it's a word that gets thrown around a lot. I want to preface this with the fact that actual anxiety is, in fact, a mental illness, and there is a difference between anxiety and stress. The same way that there is a difference between sadness and depression. Um, and in general, it can be insulting to say that, we have anxiety when we're actually just experiencing a life stressor, the same way that it's insulting to say that I'm super OCD when really you just sometimes like having your books in order. So that said, even if you don't have a diagnosed anxiety disorder, many of us experience little bouts of anxiety that go beyond the level of what we would really call like normal stress, right? And you can still benefit from the video that I'm about to show you. I also want to state up front that while I do have anxiety disorders of my own, and have for 20 years plus, and I have a degree in psychology, and I worked at a psych rehab for 5 years, I'm not a doctor. So this is just general information and opinions that I formed based on personal experiences. And you should always obviously consult your doctor before doing anything with your health. Disclaimer. Okay, moving forward. So what is anxiety? Anxiety is a fear, very overwhelming, or worry that sometimes just has no stimulus, meaning that it doesn't need to be triggered by something specific, right? It can just be. And it grows worse and worse with time. It also is very stressful and disruptive. So it interferes with your life in a very distressful way, such as you not being able to participate in social situations or activities the way that you might want to or at all. And maybe it enables you from leaving the house at all out of fear or worry. Even if you can identify that fear or worry in like the other part of your brain that's talking as irrational, but the other part of your brain is just screaming louder, and that's what you listen to. Anxiety can cause physical discomfort like sweating, shakiness, tremors, pounding heart, feeling dizzy, flushed or faint. You can get muscle pain. Chest pain is a big one for me, I know. You'll get acid reflux, like feeling like you're going to throw up in your throat, headaches, and just generally feeling like you're losing control. It sucks. This is a result of your body's sympathetic nervous system going into high alert because you're in stress mode. And it's bred into us for survival instincts, which is great for when we need it. But when you're having these recurring anxiety episodes, especially like for things that aren't really dangerous, right? These physical symptoms can get too frequent and severe, and it becomes aggressively overwhelming and just can run our lives. It can also affect your sleep. Like, it's way more difficult to fall asleep because you're spiraling and worrying about every little thing, which ultimately is going to obviously affect the rest of your life, right? Because you're running on empty and anxiety on top of that, right? So this can lead to additional physical pain because you're not sleeping, fatigue, obviously, headaches that can lead to migraines, and weight gain even. 40 million people in the United States alone suffer from some anxiety-related disorder. And women are 4 times more likely to suffer from phobias, FYI. We'll get into the specific anxiety disorders right now. So according to the DSM-5, which is the current Diagnostic and Statistical Manual, what I like to call the psychiatric Bible, it has all of the mental illnesses cataloged and what you need in order to be accurately diagnosed with that disorder, categorized into sections. So there is an anxiety section, and in that anxiety section, currently, in the most revised version of that text, is GAD, Generalized Anxiety Disorder. And side note, in the US, specifically, women are twice as likely to have GAD. And that's not a global thing. Like, actually, pretty much all over the world, it's almost even, really. But for some reason, in the United States, women twice as likely to have generalized anxiety disorder. Generalized anxiety disorder is pretty much what I've described with anxiety, and it's just like the title says, very general, right? So it can be triggered from any kind of stressor, any personal triggers, maybe not even any triggers at all. It can just come up, and it's just a very general type of anxiety. It's not due to anything more specific necessarily, like panic disorder. So a panic disorder is basically a disorder where you're having panic attacks all the time, right? I have this. So this is when you're having these, like the physical discomfort symptoms that I listed out for you earlier, that plus so much more, right? Like hyperventilating, room spinning, like passing out, crazy stuff. Like, it gets really aggressive, and that can be triggered by something specific or not. And those can be really debilitating. Like, it sucks. And then there's phobia-related disorders. They can be really specific. So, like, there's a name for every disorder, or sorry, for every phobia. If you're afraid of tinfoil, if you're afraid of clowns, if you're afraid of whatever, I'm afraid of wax people, there's a name for it. And then there's like two really common phobias, right, that we talk about, and they're actually specifically listed out separately in the DSM, which are social phobia, which is having social anxiety, right? That's something that actually a lot of people deal with, and it's recently come a lot more into light, and there's a little less stigma around it because people are coming open with it, and they're saying, I'm dealing with this, and it sucks sometimes when I'm around a lot of people. I don't know what to do. And then there's agoraphobia. That's really, really common. Not wanting to leave the house. That's a really big one, and that's obviously really impacting your life. And then there's something called selective mutism, which is more common than you might think, and this is really specific, and it also has to deal with social situations a lot of the time, where you're in a social situation and for whatever reason, you just can't talk. Can't get the words out. You might want to answer a question. You might want to initiate a conversation. Can't do it. Crippled by anxiety. Now, prior to the DSM-5, which is the current text that's out, there were a couple other disorders that were categorized in the anxiety umbrella. And examples are obsessive compulsive disorder, which I have, where the anxiety is this obsession, this intrusive thought or worry that you get obsessed with, and then you carry out an act or a compulsion, an actual behavior, to relieve the anxiety of that obsession. So a very classic example that's very easy to comprehend is a fear, worry, obsession of germs, and then your compulsion is compulsive hand washing to ease that fear obsession. Another one that was listed in the anxiety section until they released the DSM-5 is PTSD, post-traumatic stress disorder. And that you are probably familiar with is when you have a severely traumatic event and then later you end up reliving a lot of it. You are triggered by specific things and it causes you a lot of stress, a lot of anxiety, and your past trauma keeps coming up over and over again. It's common with people who have been to war, people that have been abused and raped. It can happen with any kind of trauma, but those are some very common situations. Now they have their own sections in the DSM. People that run the DSM decided that those didn't go in the anxiety disorder section anymore, and they deserve their own section. But I think it can definitely be argued that there's a large amount of anxiety wrapped up in both of those disorders, right? And I personally believe that anyone with OCD and or PTSD can absolutely benefit from anxiety-specific treatment. Just speaking as someone with OCD who has undergone cognitive behavioral therapy to treat it, that was very successful. So getting back to anxiety, what it does and what it feels like. So you can't control it. For one, it's just a general signal from your brain that something isn't right and that your body needs to go into this protection mode. And it's not with your control. You don't get a say in it. Telling yourself or someone else with anxiety to calm down or to not have a panic attack is either going to do nothing at best or make the situation worse. In fact, accepting that you have an anxiety in that moment is probably one of the best things that you can possibly do to get through that episode, honestly. Acknowledging that your anxiety is there and a part of you is one of the grandest and most advanced acts of self-care that you can do, but I'll save that for a later time. Remember when I said that anxiety doesn't need a stimulus? That part can really suck, and it can make you feel kind of crazy. So it's one thing to be like, I have this irrational fear of clowns. I don't even know why I'm afraid of clowns, but I am. And I saw a clown on a poster or a TV ad, and now I'm having a panic attack. There's a direct stimulus, and now I'm having a panic attack. That makes sense, right? But it's a totally other thing to have a panic attack out of nowhere where you don't even know why it's happening. And sometimes it takes a long time to figure out what we were actually triggered by, what our triggers are, and sometimes we don't recognize the trigger. Sometimes we might never actually figure it out because it's so deeply rooted in our subconscious. This is why therapy can be really helpful in uncovering past traumas that have contributed to our current anxieties. But it can be an incredibly painful process, and there are a lot of differing opinions on whether it's helpful or more harmful to open up Pandora's box. I honestly don't have a strong opinion either way because I think it really depends on the situation and the person. In addition to therapy, medication is a really great tool that assists in relieving the symptoms of anxiety. I'm super pro-medicine. I think we need to end the stigma of medication. I take medicine. I have been for 14 years now. Holy crap. Over longer periods of more chronic anxiety, antidepressants actually, like Prozac, Zoloft, Paxil, those like very generic antidepressants can actually be very effective for treating anxiety. I can remember being very confused when I was prescribed Prozac as a teenager for my OCD specifically. I was like, what? But general SSRIs, which is what Prozac is, can be referred to as like an umbrella drug, and they can treat many different things. There are also drugs called benzodiazepines, things like Xanax, Ativan, Klonopin. that treat more intense acute bouts of anxiety. And they can be used as a PRN, which is code for like as needed. So that could be like, oh, I'm having a panic attack, I need to take this. They're also like way more quick acting, whereas like an SSRI takes like 3 weeks to get into your system. But a Xanax you can take and it works within like 45 minutes. So it's quicker acting. Unfortunately, these can be habit forming, and if you use them for a really long time, they can lose their zing, if you will. And that kind of sucks. So there's a lot of things to consider when taking medication. They also obviously have a ton of side effects, ranging from things like as mild as dizziness to dry mouth and rashes and vomiting and suicidal ideation. It's everything. So you should always work closely with a doctor when you are taking a medication, especially when you're changing a medication or experiencing a new or change in your symptoms. Okay, so we're having all these feelings. What causes anxiety? Genetics for sure. It's absolutely a genetic thing. It's been proven. And this genetic thing leads to a physical, chemical imbalance in your brain. So what that means is that there are things called neurotransmitters in your brain that are firing off, and you just have lower levels of them than the average person who doesn't have anxiety, for example. Two of these neurotransmitters that are common in affecting anxiety are serotonin and norepinephrine. So remember when I said that SSRIs are effective medications for treating anxiety? SSRI stands for selective serotonin reuptake inhibitor. They basically block the reabsorption of serotonin at the end of the process with the neurotransmitter so that there's more left over kind of floating around in your brain for you to use up so you have more at your disposal. And that's how the medication works. And just to interject before we continue, having a chemical imbalance in your brain is a physical issue. Your brain is a physical part of your body, right? So mental health is actually physical health also, and mental health. It's both. And it's important to keep in mind that as we continue to break down unnecessary stigmas surrounding mental health, like, we should be able to feel as comfortable sharing that we are having anxiety or that we have been diagnosed with schizophrenia as we are with the fact that we just found out we have a kidney infection or have psoriasis, right? Like anything, like medical and mental health should just be the same. No more or less stigma. It's your body. It's okay. Okay, moving on. Beyond the foundation of having a chemical imbalance that causes you to be more prone to experience anxiety, there are plenty of things that can be triggers for us. And those can be behaviors that we are engaging in that create ample opportunities for producing anxiety, right? Triggers, whatever. These behaviors and situations can be anything from like stress at school or work, deadlines, problems in your relationship or marriage, or the process of going through a breakup or divorce, financial worries, debt, money deadlines, unexpected expenses, experiencing a death in a loved one, your children just in general, those are stressful, right? Having a chronic illness is extremely stressful, or being diagnosed with a medical condition. What about when a loved one is sick, or especially if you have to be their caretaker, right? A trigger from a past emotional, sexual, or physical trauma or abuse. General societal and political problems. Can't imagine. Chores and errands, as simple as that. Using illicit drugs can be anxiety producing. Even side effects of other medications, including ones that are intended to treat anxiety, can cause anxiety. And then we have stuff like over analyzing situations, constant cell phone use and email checking, having body image issues, and a lack of a support network. Oh my God, there's so many things that can contribute to anxiety, right? It's just the whole deck. There are also a number of medical conditions that can make anxiety pop up out of nowhere. Heart disease, anemia, having an overactive thyroid, a lot of nutritional deficiencies like not having enough zinc, or getting enough zinc rather. And on the other side of the coin, anxiety can lead to getting medical conditions like cancer, strokes, and a heart attack. So what do we do about it? Besides therapy and medication, what else is there to do? There's actually a lot that you can do to treat anxiety. And I am working on a really cool class called Relieve Anxiety. Very simple. And it's going to have a bunch of tips, tactics, techniques, tools, and activities that you can use to tackle your anxiety head on. For today, I just want to stress to you that self-care is the first step. Like taking time for yourself, even 5 minutes at a time, makes a huge difference. We are all so busy. Everything on that list of grievances that can cause anxiety, that eats up our schedule so much. Nom, nom, nom. It is absolutely imperative that we schedule time for self-care. Put it on your calendar. And that self-care can manifest in an innumerable amount of ways. The benefits of self-care are amazing. You will enjoy your day more, including your work shift. It'll make that work shift go by faster because if you're taking little 5-minute breaks for yourself, it just makes it flow better. You'll feel happier, healthier, and more at ease physically with pains, and you'll feel more beautiful. It will begin to strengthen your relationships, romantic, platonic, and with yourself. You'll sleep better. You'll decrease your risk for future medical issues. You'll also build up reserves of goodness to better deal with the adversity the next time something bad comes around, right? So I'm really excited to offer you this course called Relieve Anxiety. It is currently on pre-sale and it goes live on October 16th. It's going to talk even more in depth about what we just talked about the overall physiology, causes of anxiety, and what it is. But then we're going to move into treatment, and I'm going to talk about specific self-care tools that are geared specifically towards treating anxiety. I'm going to talk about healthy and holistic ways that you can treat your anxiety. And it's not just going to be talking and reading, it's going to be interactive. So I'm also going to create a hub and a haven for you to come and find some relaxation tools to calm down with, right? So there's going to be exclusive meditations, emotional freedom technique or tapping trainings. I'm going to have a bunch of interactive worksheets, affirmations, playlists, and more. So there's going to be a lot of stuff for you to utilize to reduce and alleviate your anxiety. I'm very excited to offer you this. The price is on pre-sale right now, so it's super inexpensive, and it will go up on October 16th when the course goes live. So jump in now and get it while you can for the discounted price. And while you're waiting, you can take my free, totally free self-care e-course. It's 7 days long. You get an email once a day with a little lesson, an assignment, a quote, a picture. It's just a really nice way to boost your self-care practice. I'm really excited to offer you these things, and I hope that you will take me up on this because there's too much anxiety going on in the world and not enough calm. And I know that I spent too many years and too many hours and too many nights struggling with anxiety before I knew what to do with it. And I'm happy to offer you these tools and my experiences and what I've learned. So I hope it's helpful. And if you have any questions, please feel free to contact me. The links for both of them can be found below in the caption. So, signing off. I will talk to you soon.